Okay, Grace, so I looked at their charts
Yeah.
and I kind of have a better idea of what's going on with both of my patients.
Great.
I want to go see Jose Garcia first because he had issues with pain on the last shift. He did receive hydromorphone an hour and a half ago, so I need to reassess that. He also just received ondansetron for nausea, and I want to follow up and see if that's resolved. My other patient, Jessica Smith, is a 45-year-old with a spinal cord injury that's affecting her lower extremities. Vital signs are stable at this time, and she's denying pain. There's one order that I'm a little concerned about right now, but I have to look it up a little later for her that she's supposed to get a medication, and she doesn't have any IV fluids running. And also the reason I kind of think that I should go see Jose first is he's allegedly by himself, and the husband is present with Jessica Smith.
Okay.
So I'll go see Jessica Smith second.
Okay.
All right, so I can just get started?
Yeah, just go ahead.
Okay. Knock, knock, knock. I'll wash my hands. Hi, Jose Garcia.
Yes, that's me.
My name's Jenny. I'm going to be your nurse today.
Oh, hi Jenny. How are you?
Good. How are you doing?
Oh, I am still having a lot of pain.
You are?
Yeah, I had that medicine a little while ago and it seemed to help, but man, it's coming back and it's like
did they give it through your IV here?
Yeah, they did.
Okay, I'm just gonna make a couple checks here. Can you just give me your full name and date of birth, please?
Yes, Jose Garcia, and 4/10/56.
Okay, perfect. All right. Well, it looks like you've got some IV fluids running. And I'll check that in a little bit, but I'm really concerned about your pain that's hurting right now.
Yeah, it's so bad. It's just awful.
What would you rate your pain?
Oh, probably a 7 or 8 out of 10.
So that is pretty significant.
It's just terrible, yeah.
Did that medication actually work? Did that help?
It definitely worked, but it felt like after about 45 minutes it just was gone.
Okay, so
it's at the 45-minute mark I started really getting my pain back, and now it's just like really bad.
With a vengeance. Okay.
Yeah.
How would you describe your pain?
It's like stabbing and burning and twisting.
Is it the same kind of pain that you had when you were admitted, or has it changed?
Oh yeah, totally. It's the same.
Same kind of battle. Okay. Well, I'm really concerned about the amount of pain that you're having because I want that to be under control before I can do any sort of assessments or kind of get our day going, right?
Yeah.
Okay, so I'm going to check your orders real quick and see what kind of medication I can get for you now that I know that you're in quite a bit of pain. Do you still have nausea? I got a report that you had nausea.
I do a little, but it's not that bad. No, I think it's the pain. I think once the pain is under control, my nausea will be okay.
That's possibly very true. So let me just check your chart again, and I'll make sure that we can get some sort of orders for pain medications right now.
Okay.
All right, so I'll check back. I'll wash my hands when I leave the room. And I'm just going to double check the chart real quick to make sure that if he has any sort of pain medications. I wrote down the order, but I want to make sure I have it correct. Okay, well, it looks like his order right now is, I wrote it down here, is 0.5 milligrams of hydromorphone, Q2 hours PRN for pain, and it's only been about an hour and a half, so it's not within that time frame to be able to give him more pain medications. There's nothing else available on the chart, and he is NPO. There was like a Tylenol PRN order, but he's NPO, so I don't want to give that. So I think I'm going to call the doctor on this.
Okay. Sounds good.
So I will use the SBAR form, and I take the time to write it out. And do you want me to just pretend you'll be the doctor for me?
Yes, you'll actually hear the doctor's voice.
Okay. Ring ring. Hello. Hi, I am calling about Jose Garcia. This is Jenny. I'm one of the nurses at St. Kate's University Hospital. And I'm calling about a patient who's not getting relief with any pain medications at this time. Could I just talk with you for a brief second about him?
Yeah, sure, go ahead.
Okay, so Jose Garcia is a 57-year-old who was admitted last night for acute pancreatitis. He did receive 0.5 milligrams of hydromorphone IV an hour and a half ago, which brought his pain to a tolerable level, but the pain now has increased. It's rated about 7 out of 10. All of his vital signs from report, and I can get a new set of vital signs, have been stable, and the order that I have right now is 0.5 of Dilaudid IV push Q2 hours PRN. I'm thinking this patient may need additional analgesics, either a change in the current order or to give more often or another medication. What are your thoughts?
When was the last time you received the medication, the hydromorphone?
It was an hour and a half ago.
Okay, so it hasn't quite been the 2 hours then.
Right.
So it sounds like he's needing something for breakthrough pain.
Yes, that's
Is that what your assessment is, Jenny?
Yes.
Okay, let's go ahead and put in an additional order. Let's put in a one-time order for hydromorphone, 0.5 milligrams IV push every 30 minutes for breakthrough pain only.
PRN?
No, let's stick with the one-time order for now.
Okay.
And do you mind reading that back to me, Jenny, just to make sure I got it correct?
So, hydromorphone, 0.5 milligrams, IV push, Q 30 minutes, PRN for breakthrough pain, and I will give one dose now.
It doesn't make sense to do Q 30 minutes if it's only a once order, correct? So let's do PRN instead of a one-time order.
Just PRN.
Yes. So Q 30 minutes, PRN, breakthrough pain, and make sure that is emphasized for breakthrough pain.
Okay. And I'll just look for that order to be in the computer.
Okay.
Thank you so much for your time.
Thank you.
Okay, well, I'm going to go ahead and administer that medication then.
Okay. And Jenny, just so you know, you don't have to draw all that up, just kind of tell me what you're doing and
Okay.
sort of think out loud.
So I'll look it up in the computer here, and I'll get out the medication. I'm looking for the order, and the order's in the computer. It's the 0.5 Q 30 minutes PRN of hydromorphone. So I'll find it here. And I won't draw it up, but I'm going to be doing my 3 med checks. The first time will be at the Pyxis, and then I'll do a second one with my instructor or another student nurse. And then my 3rd check will be at the bedside.
Okay.
I'm checking all my 5 rights to make sure I'm giving it to the right patient at the right time and the right med. So I think I'll go ahead and give the med.
Okay.
Okay, thanks. Knock, knock, knock. I'll wash my
Hello?
hands. Hi, Jose. I'm Jenny. I'm back.
Hi, Jenny.
Well, I have some good news. I was able to call your doctor, and they're allowing us to give you another dose of medications for this breakthrough pain that you're having.
Oh, thank goodness.
So I'm just going to double check your IV and make sure everything's going fine. You do have 125 mils of normal saline running in. Looks like it's dripping through the chamber there. And your IV site, I'm just checking the IV site, and it looks okay. There's no redness, tenderness. Does that hurt at all?
Nope, it doesn't hurt at
Okay,
all.
good. So I'm going to go ahead and administer the med. So just to verify one more time, what's your name and date of birth?
Jose Garcia, 41056.
Okay, great. Thanks so much. And I will do my 3rd check at the bedside and give him the medication. I did look it up, and the med is to be given over 2 minutes.
Okay, great.
Slow IV push.
Good.
So I'll just pretend that I gave that. Is that okay?
Great. Yep, that's fine.
All right. Jose, I just want to let you know that you're getting another dose of this Dilaudid. You haven't had any side effects from it in the past, have you?
No, I don't think so.
Okay.
What would I be looking for?
Well, one of the things with Dilaudid is it can kind of depress your respiratory drive. You may kind of slow your respiratory rate. And right now that's maybe not that bad of a thing because you're breathing a little hard with the pain that you're having.
Yeah.
So, but I also, you know, you may get kind of sleepy, you might get a little drowsy and a little dizzy with the medication.
Oh, okay, that's good to know.
But you have a call light here, and I would really like to do more of an assessment of your abdomen once that pain medication has taken effect.
Oh, okay, that sounds fine. Thank you, Jenny.
You're welcome. And is there anything else I can do for you right now as we're waiting for that medication?
You know, my throat is and my mouth is just so dry. Can I get a glass of water?
You know, we could use a couple of swabs in your mouth just to moisten up your mouth, but right now, because of your diagnosis of pancreatitis, the doctor doesn't want you to be eating anything.
Oh,
We really need to rest your gut, and I'll talk with you a little bit more about that process in a little while once you're feeling better.
Oh, okay.
All right.
I do remember that now.
Okay, so we'll go over it again when you're feeling, when you don't quite have as much pain.
Oh, okay.
All right, well, I'm going to check on another patient, but I'll come back to check on you.
Okay.
And you have your call light there, and the bed is in the lower position, so just let us know if you need anything. And because of the pain medication, you might get dizzy. It's best to use your call light if you decide to get out of bed.
Okay, I will do
Alright.
that, Jenny. Thank you
Okay,
so much.
yeah, I'll be back to check on you. Thanks.
Okay.
Okay, so I'm going to go check on Jessica Smith. And I'm just going to see how she's doing first. I did look in her computer in her chart again, and it looks like she has a Lovenox that's due, but it's out of like therapeutic range for prophylaxis
okay.
for DVTs. It's supposed to be 40 milligrams, and the order's for 100 milligrams.
Okay.
So I think once I check on her, then I'll call the doctor and see if they want to change that order.
Okay.
All right, so I'll knock first. Knock, knock. I'll wash my hands.
Hello.
Hi, Jessica. I'm Jenny. I'm going to be your nurse today.
Oh, hi, Jenny.
How are you doing today?
Oh, I'm okay.
Okay, good. I just want to double check that we got the right wristband here for you. Can you give me your name and date of birth, please?
Sure, it's Jessica Smith, 1168.
Okay, great. And are you allergic to any medications?
Yes, I am allergic to morphine.
Okay, that's good to know. Thank you. How I know that you had an accident a couple of days ago and you're going to be having surgery tomorrow.
Yeah.
How are you feeling today?
Oh, well, I'm feeling a little anxious, but I'm doing okay.
That's understandable. I can only imagine. Would you mind if I took a set of vitals?
Oh, no, not at all. Please do.
And then I will get those. So what are her vitals? I'm looking for blood pressure.
So her vital signs are 80/40 for blood pressure.
Okay.
Heart rate is 70. And what else did you want?
Temperature.
98.4.
Okay. And respiratory rate.
12.
Respiratory rate of 12. 80/40. Okay, well, I'm concerned about that, about her vitals. What's her oxygen saturation?
98%.
98%. Okay. Well, you know, Jessica, I just checked your vital signs. Are you feeling dizzy at all? I'm a little concerned because your blood pressure's low.
I am feeling dizzy, but the last nurse said that it might be because of that anxiety medicine I've been taking, but I have felt dizzy, yeah. Whenever I sit up, I just feel like I'm gonna pass out. That's why I've had the bed down a little.
Okay. You don't have any fluids running. I'm gonna actually call the doctor because I am concerned. I noted that your last blood pressure was in normal range and now it's dropped significantly. So I do want to notify the doctor of the change in vital signs, and I'm to see if they want to have any sort of intervention.
Oh, am I gonna be okay? Oh, I'm so
You know,
worried.
sometimes this happens, we get changes in vital signs, and we just consult with the doctor, and we can go from there.
Well, okay.
All
It's
right.
just one thing after another.
I know, we'll do whatever we can to help you out today.
Okay.
Okay, so I'm gonna actually call the doctor now. Your call light is on the side of the bed here, so it's the red button. If you need anything, if you get dizzier or start to not feel so well, I want you to hit the call light and we'll come in.
Okay.
All right?
Thank you, Jenny.
You're welcome. I'm just gonna put this other rail up in case you want to turn to this side, if this actually goes up. Okay, there we go. So I'll be back to check on you then.
Okay.
Okay. And I'll wash my hands on my way out, and I want to call the doctor about those vital signs because they are lower.
Okay.
And let's see here. And the other thing is she has vital signs, and then the Lovenox. Okay, so I'll call the doctor. Ring, ring.
Hello.
Hi, my name is Jenny. I'm a nurse at St. Kate's University Hospital, and I'm taking care of a patient of yours. Her name is Jessica Smith. And are you able to I have a couple concerns regarding her care. Am I able to talk with you about that right now?
Yeah, go ahead.
Okay, she is a 45-year-old female who fell from a roof 2 days ago and got a spinal cord injury at the T10 level. And her vital signs have been stable since she's been here, but I'm concerned that right now the last set of vitals I got, her blood pressure had dropped to 80/40. Her heart rate is 70. Her respiratory rate is 12, but her sats are 98% on room air. I'm concerned about this drop in blood pressure, and I'm wondering, she is not on any fluids. She did receive some Valium. It's been a couple hours since she received that, and I'm just concerned about her vitals here. She perhaps needs to be on some fluids or some other therapy. Do you have any suggestions for me?
What has her blood pressure normally been running?
It's been like 120/80.
Oh, okay. And does she have any history of congestive heart failure? Remind me.
She does not have any history of anything before this injury.
Okay. Let's go ahead and give her a bolus of some IV fluids.
Okay.
Let's do normal saline, 500 milliliters over an hour.
So a bolus of normal saline, 500 milliliters over 1 hour.
And then recheck vital signs after that. If systolic is lower than 90, give me a call back
At that time. Okay.
when you recheck.
All right, so I will recheck the vitals after that hour. If the systolic is below 90, then I'll give you a call back.
Okay.
And hopefully this will do the trick.
Okay.
All right, thanks so much. Okay, so I'm gonna continue on and get the, oh shoot, I forgot to call him about the Lovenox. That's not one of my big concerns right now, so I want to take care of the blood pressure right now, and if I need to call him back, I'll just do that after, because this is more of a concern.
Sure.
Because I know that Lovenox is not okay.
Sure.
All right, so I just want to double check the order in the computer here. And it looks like it's in, so it's exactly what he had told me. Normal saline, 500 mils over 1 hour, and then recheck the vitals. So I will do my 3 checks. The last one will be at the bedside, and I've got the IV fluids here, and it'll be, I'll set it so that it's 500 mils over 1 hour. So the rate will be 500. So I'll go back into her room.
Okay.
Knock, knock.
Hello.
Hi, it's Jenny again. How are you? Are you still feeling about the same, Jessica?
Oh yeah, I almost feel a little more dizzy. I don't know. Maybe it's
Do you
because
really?
we're talking about it.
Okay, well, I think given that you're more dizzy, I'd like to recheck your blood pressure and pulse. And I'll count what's her respiratory rate now? Is it
Her
still about
respiratory-
12?
Yeah, it's still 12, and we'll say her blood pressure is 82/42.
Okay, so it's not changed in her heart rate, is it still?
Her heart rate is 68.
Okay, so that's really unchanged. Well, Jessica, I have here some normal saline. We're going to give you a bolus of fluids, which means that we'll give 500 mils, a half of a liter over 1 hour to try to get your blood pressure up.
Okay.
Okay.
That sounds good.
And just to verify, can I get your name and date of birth again?
Sure. Jessica Smith, 1168.
Okay, great. Thank you so much. And it looks like you have your IV site over here. I'm going to go ahead and flush it. Use an alcohol swab and go ahead and flush it to make sure that the IV is working okay. And do you have any tenderness at all at your IV site when I flushed it
no,
through?
it feels fine.
Okay, flushed through without difficulty. So I'm just going to go ahead and hook this up. All right, I'm going to get this started, and I actually want to check on another patient real quick, so I will be back to assess you in just a little while.
Okay.
Okay.
Thank you, Jen.
Thank you. Okay, wash my hands, knock knock. Hi Jose,
Hello.
you know how are you feeling? How's that pain?
Oh, my pain is so much better.
Good.
So much better. Thank you so much. Bless you.
Okay, well, unfortunately I forgot to get a set of vitals when I was in here the first time. So
yeah.
I want to get a set of vitals on you. Do you mind if I do that?
Oh, not at all.
Okay, so what is his blood pressure?
110/80.
110/80. And his heart rate?
80.
And respiratory rate?
18.
And O2 sats, he's on room air.
98%.
98%. Respiratory 18. And temperature?
98.6.
98.6. Okay. Well, it looks like your vital signs are really stable and they're going well. Do you have any pain at this point, or is it completely gone?
I'd say it's like a 2, but it's totally tolerable.
A 2 out of 10 at this point.
Yeah.
That's so much better. So that's tolerable at this point.
Oh yeah, that's
Okay.
fine. I mean, I'm a tough guy.
Okay, that's a good thing. Well, at this point, I'd like to do a more thorough assessment for you.
Yeah.
And because you have pancreatitis, I'm going to do a kind of a GI gut assessment.
Yeah. They said this is related to my gallbladder, right?
Well, I can talk with you a little bit about that. The pancreas and gallbladder are so close to each other, and they're both involved in digestion, that what it sounds like is one of your gallstones has kind of blocked that area and has not allowed the pancreas to work normally.
Oh man.
So unfortunately, when the pancreas is blocked and can't essentially secrete or distribute all of the enzymes that break up the food that you eat, it backs up in your pancreas, and it actually kind of it starts to irritate the pancreas quite a bit. So that irritation is what ended up causing you all of the pain, and that's why you're here.
Oh, that makes sense.
Mhm.
Nobody's told me that.
Okay, well, I'm glad that that's helpful. Do you have any other questions for me?
No, I don't think so.
Okay, the reason why we're not giving you any food is the best treatment for pancreatitis at this point, especially in your case, is to rest the gut. So we're not going to have you take anything in by mouth.
Okay.
For that reason, we have you on some normal saline at it's 125 mils an hour, which is a pretty good rate for replacement fluids. So you're getting enough fluids for yourself right now.
And they can't just take the pancreas out, huh?
No, the pancreas is quite the vital organ, so unless there's something very significant to get the pancreas out, you would keep it in.
Oh.
Sometimes these do become surgical cases, and that would be something that your doctor would have to talk with you about.
Okay.
But right now, we're just monitoring you and treating you for the pain and letting your gut rest.
Okay. Thank you, Jen.
Okay, Okay, you're welcome. So I want to do a full GI assessment. When was the last bowel movement you had, Jose?
Oh, I think I had one this morning.
You had one this morning, and was it normal?
Yeah, it was pretty normal.
And no blood in the stool at all that you noted? It wasn't black?
No.
Okay, good. So I want to first take a look at the abdomen and visualize it, and I do not note any he's a little distended, but no other major signs of issues. I'm going to auscultate and listen in all 4 quadrants.
Okay, bowel sounds are active.
Okay, great. Normally active? Yeah?
Yeah.
Okay. Now because your pain has subsided, I want to go ahead and kind of palpate your abdomen and check for any tenderness or any abnormalities.
Oh, it's a little tender
A
there.
little tender on the left side there. Sorry about that.
That's okay.
Okay. Good. Have you been peeing normally too?
Yeah.
Okay.
All these fluids are going right through me.
Yeah, I'm sure. Well, just be sure to collect your urine either in the urinal or in the hat in the toilet that we have there set up for you, so we can keep good track of your eyes and of your intake and output.
Okay. I've been using the urinal because you told me not to get up.
That's totally, yeah, absolutely. So that's really
because
good.
I might be dizzy.
Yep. And are you feeling dizzy at all?
I don't think so. I mean, it's hard to tell laying in this bed, but I don't think so.
Okay. Well, I'm gonna let you relax for a little bit, and I'll come back to check on you in a little while.
Okay.
Do you have any other questions for me, or do you need anything?
No question.
Okay, well, your call light is there, and I will be back in a little while.
I mean, unless you want to bring me a burger.
I wish I could, but unfortunately, like I said, we're going to keep the NPO at this
All
time
right,
without
Jenny.
any food.
Okay.
Okay, thanks. I'll wash my hands on the way out, and let's see here. I just started her fluids going at this point. I'm going to take a moment and call the doctor about the Lovenox and see if they want to change that order.
That sounds like a good.
Okay. Okay, hello?
Hello.
Hi, this is Jenny. I'm calling from St. Catherine University Hospital, and I'm taking care of Jessica Smith. Are you able to help me out at this time?
Yes.
Okay, so Jessica Smith is a 45-year-old who fell off the roof a couple days ago and has a fracture at the T10. So I know I talked with you a little bit earlier, and I apologize for calling you back. I did start the fluids, and hopefully her blood pressure will increase. But I do have another concern because her Lovenox is ordered, and it's to prevent DVTs. She's doesn't have any issues at this point, and the order is for 100 milligrams. And my understanding is that Lovenox should be given at 40 milligrams for prophylaxis DVT coverage. So I'm wondering if we should change the milligrams for that order.
You know, Jenny, that's a good catch on your part. Why don't we go ahead, since she's having surgery tomorrow, why don't we hold the medication and I will discontinue it. And after surgery tomorrow, we'll reassess and see if we want to start the Lovenox back at the correct dosage.
Okay.
And does she seem to be feeling a little bit better now that the fluids have started?
You know, I just started the fluids, and I'm going to go reassess her at this time.
Okay.
But I did do another check of the vitals, and they were still about 80/40 when I started the fluids.
Okay.
All right, thanks so much for your time.
Uh-huh.
Okay. Okay. So I'm going to go ahead back in with Jessica Smith and do my assessments with her and see how she's doing with the fluids.
Okay, sounds good.
Okay, knock knock, I'll wash my hands.
Hello.
Hi Jessica, it's Jenny again.
Hi, Jenny.
How are you feeling with that dizziness? I know it hasn't been that long since you've been receiving the fluids.
I don't know. I feel like I'm starting to feel a little better.
Okay, well that's good. I'm gonna go ahead and check your vitals in a little while once you've got the bolus in, and we'll see if your blood pressure's improved.
Okay.
And I just want to let you know, I know you've been receiving the Lovenox. It's that shot that burns in your belly.
Oh yeah, I don't like that.
Yeah, so I checked the dose and ended up calling the doctor. He doesn't want us to give that to you today, mainly because you're having surgery tomorrow.
Oh, okay.
Do you know what Lovenox is used for?
Sort of.
Okay, well, in this case, it's used as a preventative medicine to prevent clots forming in your legs. So it's a
that
lower
can
dose
happen.
of a blood thinner, and so we just don't want you to be having clots. But missing this dose today because of surgery is not a problem at all.
Oh, okay.
Okay.
I'm
good.
not. So I'm not gonna get a blood clot.
You've had coverage for a couple of days, and our hope is that you won't get a blood clot.
Oh, okay, yeah.
Yeah,
Because I don't want to bleed during surgery.
that's exactly right.
Right,
Yep, since you're
okay.
having surgery, puts you at a greater risk when you're taking Lovenox for bleeding.
Okay.
Okay, so I wanna, if you don't mind, I wanna take some time to do a full assessment on you.
Oh, okay.
Okay, so I'll do a neuro assessment on her. And I've got my pen light here, so I'll check her pupils.
Sure. Okay, and what are you looking
I'm
for
looking
there?
to see if they're reactive and equal and round.
Okay.
They're perla,
Mm-hmm.
and they are. So can you go ahead and open up your eyes really wide,
Yep.
and then puff out your cheeks,
Okay.
and
Yep.
smile really wide.
And we'll say all those are normal.
Okay, and shrug your shoulders.
And she shrugs them both, and they're equally high and strong.
Okay, good. And then I want to check your grip. Can you squeeze my hands really hard?
Sure. And we'll say grip strength is equal.
Okay, and I have, that's good. I want to test your sensation here as well to just see where you're actually feeling sensation.
Oh yeah.
So if I kind of touch you right here, are you able to feel this?
Yes. Yep.
Okay, and what about right here?
Yep. A little bit.
Uh-huh.
Yep. And then right there it gets numb.
And it's numb. Is it actually a numb feeling, or do you feel it at all?
I don't feel it at all.
You don't feel it
I wish
at all?
I did.
Okay. All right. I know. I wish you did too. I'm sorry about that. And then, are you able to feel this at all?
No, I mean I
Okay.
can see you touching my feet,
Yeah.
but
Okay. I'm sorry about that. Do you
Yeah.
have any pain right now at all?
you know I don't. I don't have any pain.
Okay. Well, I'm glad that you didn't get any sort of, when you fall off a ladder, that's pretty traumatic. So
Yeah.
I'm glad otherwise you're doing okay. Let's see here. I also, because you have received medications in the past, and sometimes with an injury like that you have, your gut can kind of slow down and not be as regular as usual. Have you had any bowel movements since you
I
got here?
haven't. My belly's been hurting a little bit, but you know, I don't know. Maybe it's just because I'm worrying so much. I don't know. I'm trying to eat, but it's hard.
Okay, are you passing any gas?
I have had some gas, especially today, so I'm hoping,
That's
but
a
it's
good
hard.
sign.
I can't really feel anything down there the way I used
Yeah.
to, so I'm not sure.
Okay.
I'm worried I'm gonna have a bowel movement in the bed and just not know it.
Well, sometimes that can happen, and you know we're here to help you out, and it is understandable. Okay.
Okay.
I want to go ahead and assess your abdomen here,
Okay.
and I'm just checking. I'm visually checking the area, and then I'm gonna auscultate and listen to her bowel sounds.
Yeah. And we'll say vowel sounds are all equal.
Okay.
Normal.
Normal, and then
But her belly looks a little bit distended to you.
okay, so it is a little distended, probably because she hasn't had a bowel movement at this point. I want to go ahead and palpate too throughout. And am I noting anything?
No, you're
No
not
masses
feeling
or-
anything abnormal. She's not
Okay.
having any pain anywhere.
Okay. All right. Well, another thing that we can do to help with getting your bowels moving is to increase your fluid intake. So I know that you've been
yeah.
having meals and drinking plenty of fluids, but we'll just try to increase your fluid intake. That may also help with your blood pressure as well, just to make sure you're full enough of fluids.
That's true. Okay, I can do
Okay.
that.
Do you have any questions for me at this time?
I don't think so, Jenny.
Okay. All right. Well, I'll check back with you in about 45 minutes when the fluids are in, and we'll recheck your set of vitals.
Okay, sounds good.
Okay. All right, thank you. Okay, well, I think with both my patients, we'll recheck her vitals in a little while, and Jose, his pain is doing better, so I think I'm done with my sim.
Okay, great. So
Okay.
you'll just report off to your next nurse.
Okay,
The next nurse, okay?
that
And
sounds
that'll
good.
kind of be the final part of your sentence.
All right. Oh, I'm glad it's done.
Yeah, I'm sure you are. It's always nerve-wracking for everybody.
Hi, Kayla.
Hi, Jenny.
How are you doing?
I'm well. How are you?
Well, you can use one of those.
Okay.
And Kayla, I'll go over the instructions a little more after you get a report from Jenny, okay?
Yeah, I borrowed a pen.
Oh, sure.
I did not come.
Okay, well, I'm gonna give you a report on two patients. We have Jessica Smith in that bed over there, and then Jose Garcia is right behind you. They are actually in two separate rooms,
Oh.
so you can pretend. So I'll start with Jessica Smith. She's a 45-year-old female who fell off a roof clearing snow and sustained a fracture and spinal cord injury at the T10 2 days ago. She did receive the high-dose steroid protocol for spinal cord injury and finished that yesterday. Unfortunately, she is paraplegic at this point and has no function or sensation below the umbilicus. The fracture is stable, but she'll be going to surgery tomorrow for a fusion. And on my shift, she hasn't been complaining of pain, a little bit of abdominal discomfort at this point, but she has not had a bowel movement since admission. She is passing gas though. Bowel sounds are active in all 4 quadrants, and her belly is a little distended. In terms of the surgery for tomorrow, she's aware of the NPO status at midnight, and she did have a Lovenox order that was 100 milligrams. I called the doctor and they have discontinued that. It was too high of a dose, and they also want to hold that because of her upcoming surgery. One of the concerns on my shifts with her, however, was the fact that her blood pressure was 80/40, and her respiratory rate was 12. All other vital signs were within normal limits. So I called the doctor about that. Her previous vital signs were more like 120/80 and much more stable. So he ordered a 500 ml bolus of normal saline to be given over 1 hour, and that's hanging right now. She is a little symptomatic. She is dizzy, so that was kind of one of the big concerns. And I did, because the dizziness worsened, I checked her vitals again and her blood pressure hadn't changed. It's still about 80/40. Let's see here, what else can I tell you about her? Do you have any questions so far?
Is she able to eat and drink?
She is on a,
just not until midnight.
yep, she's on a full diet, and I did talk with her about increasing her fluid intake to help with moving her bowels and to help with the hypotension too.
Okay.
And the dizziness.
Okay.
Okay, so your second patient is Jose Garcia. He's a 57-year-old male admitted with acute pancreatitis. On admission, he had severe right upper quadrant abdominal pain and mid-back pain. He did get dilaudid a couple of hours ago from the previous nurse, and I called to get an additional hydromorphone order because it was not holding it. His pain when I came on shift was writhing in 7 out of 10 pain. So I got an order for hydromorphone to be given 0.5 milligrams, IV push, Q 30 minutes PRN for breakthrough pain. So that really should only be given if the pain is out of control like it was on my shift.
Okay.
His vital signs have been stable. The only thing is he's been a little tachycardic at 90 beats per minute. He was battling some nausea on the previous shift, and he got 8 of Zofran of ondansetron, and that ended up helping out with his nausea. And there's been no vomiting. He is NPO, and he did have a dry mouth and was requesting water. And I did explain to him about the fact that he needs to be NPO and should not be taking anything by mouth. What other questions do you have for me?
How did the dose of Dilaudid do for his pain?
Oh yeah, thank you. So he did end up, his pain ended up being 2 out of 10 after that dose of Dilaudid, and he was so much more comfortable.
And
able to
now,
do my assessment.
like I can give him another dose of his Q2 hour Dilaudid.
Correct.
And then if for some reason his pain comes back before he's due for another dose, that's when I can give
The breakthrough
pain
Yeah,
order.
exactly.
Okay.
Yeah, I think that's about it.
Okay.
All right, thanks. Good luck.
Thanks.